Hi, my name is Nga Yuan, and this is EFM, the Resource Center for all conversations on entrepreneurship in action. We are in the Demo Day series where we are excited to speak to the most recent batch of startups under the University Malaya Deep Tech, UMDT. UMDT is a startup accelerator with the University Malaya Center of Innovation and Commercialization, UMCIC. And today, we are very lucky to be speaking to the founder of eProfiler Private Limited based in UK, Dr. Vengadesh Priasamy. Hi, Dr. Vengadesh. How are you?
Hi, I'm fine. Good afternoon.
Good afternoon. I'm really excited to I've seen you do the demo day just a couple of days ago. So now I want to find out a little bit more about your commercialization journey. But before that, tell us about eProfiler.
Okay, that will be an interesting story to know because I guess a lot of people would be also trying to be an entrepreneur. So hopefully I can share something interesting for them. Well, I always was like kind of fascinated with biomaterials, for example. My master's and my PhD was all in that field. DNAs and RNAs were especially very interesting because these are the biomaterials of life. And I really wanted to do something in trying to understand them. So along the way, I didn't know of the impact of what I was actually studying, but I actually never thought I thought that I'll remain as an academic forever. Never thought that I'll be becoming an entrepreneur one day. Well, along the way, also, I actually realized that inevitably you will have to take the biggest responsibility if you want to make something big out of your own research. And basically, that's how I am here at the moment talking to you.
That sounds like a really unexpected journey for you. But let's find out a little bit more about the star product that you would like more people to know about, the e-profiler. Is there like a series to it? Like there are a few e-profilers, I assume.
Okay, this is basically based on a few technologies that I was working on. When I say technologies, it basically means results of some experiments that I run. And I realized that, oh, wow, that's a good finding and that would be useful in making things. And since I was working with DNAs, RNAs, and proteins later on, I realized that this could be very important in the field of medical technology. So effectively, what came out of this is a realization that, well, you could actually use this technology to diagnose people, diagnose in the sense that you can detect pathogens. And more important than that, actually, you could characterize these pathogens that infect human beings. For example, COVID-19, for example, the challenge here is to understand why they are so strong, for example. How is it so easy for them to infect people? Well, we can do that traditionally in ways that people are using currently, but the outcome of my work was that we can actually use electronics to actually understand them better, and excitingly, it gives us more insight in a more rapid manner. So what I basically realized is that each of these organisms has their own signatures electronically. So if I can build a solid state sensor, I'm working on the field of solid state sensors, I could basically be able to acquire these signals and therefore make detection, for example, in 5 minutes. So basically that's what I understood. And I'm pretty excited that this could probably in the next 5 to 10 years be quite rampant in the field of medical science.
So where are we now in terms of research? What level of TRL?
Okay, we
TRL.
have actually come to TRL 4, which is I feel as much as an academic can do before venturing into entrepreneurship, because basically entrepreneurship is a longer journey. It's a huge journey. I'm effectively in a valley called Valley of Death. Basically, entrepreneurs term this period. You have your innovation that could be the best in the world, but it doesn't mean that you could commercialize it. So I'm basically sitting right there. So having this spin-off and getting approvals from the University of Malaya is not the beginning. It's not even the beginning. So right now I have a team. For the last 1 year, we've been working very hard. Since COVID came into the picture, I was actually approached by some friends and partners that I had in UK, asking if I would be able to transform this into a spin-off or a startup. And that's basically how it all started. Prior to that, I was having an idea that I have to start this, but then I was still an academic, and very much an academic. I don't really wanted to venture into these things. But when COVID-19 came, we took it as a challenge to actually come up with something. And 1 year passed. We're going to celebrate our anniversary of getting together. Four of us in a team. My partners in UK basically started this idea, and we wish to change it into at least TRL 6 in about 2 months' time. We have a series of investors ready to come in, so I don't find that as a big challenge for me. All has been done by my partners. My R&D at the moment, we have a prototype. We're trying to make that more like a commercial product at the moment. And within 2 months, we will probably have our first product, which is basically a detection kit. It's a rapid detection kit, which is as good or even more better than the golden standard.
Wow. And so the sensor that you will be taking from, let's say, the patients, what are you going to be putting on the sensors before you put into this detector kit?
Okay, the whole idea about a rapid detection kit, I'm actually more interested in working with characterization tools, because when you want to make drug delivery, damage and repair studies of certain pathogens infecting your body, you basically want to characterize these things. So this actually works as a characterization tool for these biomaterials of life. And we can also do this for studying different types of pathogens. Yes, but the COVID-19 challenges has actually changed that scenario a bit, where we had to emphasize this first as a detection kit. So the whole idea is to make it much simpler and less complicated than the current standard, which is the PCR systems, PCR test kits, molecular techniques, which are the golden standard. If you want it rapid, you can't have a PCR based system. If you want to check for the antibodies, maybe you can have a rapid kit, but it's not as accurate. So we want to overcome all these challenges. So what we did is that we thought that the electronic way of doing it using a solid state sensor, which is disposable, costs you a few cents actually. And then you have to basically literally take samples out of your body and place them on the sensor and then run the test. So this is ideally how it works. Of course, there's a few more challenges that we have to go to that level, but that's our second product. The first product requires a slightly little bit of work, but is much faster and much rapid than the current standards. So simply put a sample on the electrodes, 5 minutes of time. It's a fully automated device because it's electronic, right? No intervention. Within 5 minutes, the system does the analysis and gives the person who's taking this test, or the personal medical personnel, an answer, positive or negative. As simple as that.
So it would probably, in my head, I'm imagining it as a detector kit that is as big as your handphone, for example. You could fit into your pocket. You walk around the ward. You come to a patient, and you look at his chart, and you make a certain diagnosis, and you want to confirm your diagnosis. So then you put on you put on the
The sensor,
electromagnetic sensors,
yes.
the pathogen onto the sensors, and then into your kit, and then voila, it's a positive or a
The
negative.
samples probably could be some nasal discharge, saliva. So this is
So you're
how
basically
ideally
walking around with a lab in your
exactly.
lab coat.
This is what the current world lacks of. We can't do that. If you have that, you could have a detection within minutes, which means that you can pay more attention to actually finding the cure. And for example, if you have detection at the earliest onset, well, treatment is easy, right? If you want to control COVID-19, yes, detection is still the number one factor. If you can catch someone with disease at the earliest onset, means that you separate them out of the rest of the healthy population. So this is what we intend to actually achieve. Give them that time to actually do the treatment, get the people isolated.
So while I understand that, Dr. Vengadesh, you are focusing on the detection kit itself. So which one of your co-founders or your co-partners are looking at what department of the entire medicine that you'll be focusing on first? Is it transmittable diseases? What would it be?
Okay, we have changed our priorities actually from how we worked on. Of course, COVID-19 was the thing that actually started this all up. So this is probably the silver lining to that 1 year of being in the house, not being able to travel probably, but it also gave us a time to actually get the group on standby. We're going to launch the website very soon. How all this is done. So we basically decided COVID-19 is still very much relevant, and that's also the biggest problem the world faces. So we will definitely have to look at that first. But along the way, we also realized that this infection is going to stay for a long time. And the previous infections based on animals, as we can understand right now, has is still around actually. We still have cases going on. So we probably have these numbers so low, but probably this will still last longer than we think. So we will have this system worked in place. But of course, looking at how things are changing, hopefully we are out of this kind of a doomsday situation. So hopefully everything goes back to normal. The next big thing that is the most important thing, and it's still a big thing at the moment, which I actually wanted to start first, was dengue and Zika. So we have a list of priorities run, and we have actually separated into different countries too. Because for in Africa, there's a lot of issues with, for example, parasites in the tummies, if I put it in a nice way. Children, having no symptoms, having bad history of medical problems, and then fatalities are very high. So we have actually highlighted a few of the parasites over there. Zika is obviously in South America, dengue in Malaysia. So we have a list of things, and we are also trying to work together with private companies who are looking into electronically characterizing pathogens useful or not useful in their industries. So we have already started with a company. We are actually collaborating on a kind of a research thing. So yeah, we have this portfolio of things to do, but starting with COVID-19. So basically, the first product that we will launch will look into a solution for COVID-19 detection. And as we go on, the same product we will also apply to companies, biotech companies looking for electronic solutions. Basically, if I want to put it in a very nicely understood way, it's like a tagline that we have actually. We say that all organisms has their own barcodes, including the antibodies, and we kind of have the barcode reader.
Yay! That sounds really exciting. I can't wait for it to materialize and that our doctors can make full use of their time looking at solutions instead of wondering about diagnosis. Thank you so much, Dr. Vengadesh. I appreciate this and good luck.
Yep, thank you.